Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McRae.
Measles cases in the U.S. have surpassed the highest number on record since the disease was declared eliminated in the year 2000.
Eliminated means that it's gone.
Eradicating.
Okay, just wanted to be sure.
We thought so. Now, to date, over 700 measles cases have been reported in 22 states.
Here to tell us how this has happened and why is infectious disease specialist and vaccine expert, Dr. Greg Poland. Welcome back to the program, Dr. Poland. Eliminated?
Eliminated? You would have thought so. And we were headed that way. But, Tom, you're exactly right. Over 700 cases. This is more cases than we have seen in the last 25 years. 1 out of 20 kids that get this disease are going to get pneumonia. 1 to 3 out of 1,000 that get it are going to die as a result of it. I've gotten questions from physicians that are seeing pregnant women who have been exposed to measles. Why is this happening? In a word, unimmunized people. They're just rejecting the vaccine based on false information that lingers out there on the internet.
When did that start? When did this misinformation start to come onto the internet?
Yeah, it really started about 1998, I think it is, when Andrew Wakefield published an article which has now been retracted.
The British Medical Journal?
It was in the Lancet.
Lancet.
He was stripped of his medical license because he fraudulently published these misleading and wrong data that he drew conclusions from that have dearly cost people's lives. The outbreak so far in the U.S. has been estimated to cost somewhere around $35 million, and it's not over yet.
Is he the one that wrote the article that suggested that vaccines could cause autism?
Correct.
And then it was later retracted.
It was later retracted. There have been some 20 studies over 2 decades in multiple countries, every single study showing it just isn't true.
There has to be something about the conspiracy angle of it. I mean, the psychology of it is the conspiracy angle, and that is taking hold in certain populations more than others.
Yeah. It tends to be, you're exactly right, Tracy, it tends to be in populations that are more insulated and less well educated, and then ironically, in the insulated, well-educated communities. There's an island off the state of Washington, for example, that has among the lowest immunization rates, and the average educational level there is a master's degree.
Herd immunity on that island must not be very strong.
It's not present.
So tell us what is meant by herd immunity.
So herd immunity means that if all of us get the vaccine, then those of us who don't respond or for some reason can't get the vaccine are likely to still be protected because everybody around us is immune.
Now, you said who can't get the vaccine. Yeah. Who can't get the vaccine?
So the MMR vaccine is what we're talking about. And
measles, mumps, rubella.
Right. People who are immunocompromised or who are pregnant can't get that vaccine.
All right. What about people who don't want to get it for religious reasons?
Yeah. So there are groups like that. There's actually no prohibition in the Bible against anything like that. But different religions have their different beliefs, and they have sometimes been a cause of that. Let me dispel one myth. A large number of the measles cases in New York are happening in Orthodox Jewish communities. Those communities tend to be less well educated, surprisingly. They don't let their children get educated very far into the system. But the rabbis have told them there is no prohibition against getting vaccines. Indeed, they've encouraged them to get vaccines. But when you're an insular, less well-educated community, it's word of mouth, misinformation, fears, emotions that tend to make the decisions. And then, we have to admit, we live in a culture where an increasing number of people don't believe that science is a way of knowing, and they reject it.
Yeah, interesting. So the World Health Organization has named hesitancy on the part of parents one of the top 10 the hesitancy on the part of parents to get their kids vaccinated, one of the top 10 global health threats.
Exactly right. And they did that as not only warranted by the data, but to send a signal that these diseases, which, as we pointed out at the top of this, had been eliminated, moving toward eradication. Measles is eradicable. We could eradicate measles like we did smallpox, and this would never be a problem on Earth again. But we haven't done that, and they're sending the signal that this is a global health threat by denying vaccines and rejecting getting them.
When did the MMR become available? How long has this vaccine been around?
So what we should say is that at first it came out as the individual components going back to 1968, and then they put the three components together. I think it was in the late 1970s.
Okay, and so many of the diseases that you come in to talk to us about are changing, continually changing. So the measles, that virus?
Yeah, measles is considered a monotypic virus. So while it has some changes with it, it's not like influenza. It doesn't escape being controlled by the vaccine, unlike influenza.
Because of the measles outbreak, are there people in the U.S. today who should go ahead and get the measles vaccine, or at least get a booster if they haven't had both shots?
So let me be kind of blunt here, Tom. Because of the risk, the medical risks of getting this vaccine, my personal opinion is one would be foolish to not be protected against this disease. You travel to any major city. We have outbreaks now in 22 states right now in the U.S. So are you likely to get exposed? Yeah, there's a quantifiable risk. Depending on where you live, there's a high risk. They're trying to do things like quarantine colleges and tell unimmunized people not to go to work, et cetera. That's not going to work very well. This outbreak is going to continue to spread. So if you've not been immunized, you need to be immunized. If you only got one dose of vaccine, you need a second dose of vaccine. If you were born before 1957, like two of us here,
you and Tracy, huh?
then you don't need a vaccine. You had the disease. So I know I had the disease as a kid. I have lifelong immunity from that.
But it is highly contagious, isn't it?
It is, in fact, the most contagious human virus we know of.
Is that right?
Yeah. So if we were susceptible and somebody with active measles had come into this room 8 hours earlier, we would get the disease. That's how contagious.
8 hours?
8
because
hours.
it just lingers in the air. You don't even have to touch something. It's just in the air.
Correct.
All right, let's dispel some myths about the measles virus. You've dispelled a fair number of them already. There are natural ways to prevent the measles, so I don't need the vaccine.
Couldn't be more wrong. There is no natural way to prevent measles.
This one we touched on. The measles vaccine causes autism?
No evidence for that whatsoever.
You don't need to get a booster shot if you've already received the measles vaccine.
That's not true. So, in other words, if you've only gotten one dose, you need a second dose.
What about kids that were born after 1957?
So they are the people. You have any interest in this?
A slight interest.
So those individuals should get 2 doses of vaccine.
Okay.
You can get the measles multiple times, even if you've already had it.
No. Unlike chickenpox or influenza or some of those sorts of diseases, once you've had measles, you're immune to measles.
All right, getting the vaccine ensures I won't get the measles.
Partially right.
Yes and no.
When you get one dose of vaccine, somewhere about 90 to 93+% of people are immune and are immune for the most part for life. And you get that second dose of vaccine, you get that level of immunity up to somewhere in the 95, 97%.
Oh, I wanted to ask you one other thing, a couple of things. The government can force you to get vaccinated.
There's actually a ruling where they can do that. In the interest of the public health, they can require you to be immunized.
No kidding.
Yeah.
And is there, and what if you don't? Is there a potential fine?
Well, let me say that the last time we had a measles outbreak, there was a judge in Philadelphia that ordered a nurse and policeman to go to a home and immunize, I think it was 2 children.
Wow. All right. One other thing I wanted to ask you about, the CDC said that the current outbreak started through importation.
Yes. That's an
Explain
important part. So we don't have indigenous circulating measles virus in the U.S. That's what the elimination means. What has happened over time is we've developed larger and larger pools of susceptible people. That's why these outbreaks are occurring in larger cities for the most part. Then what happens is somebody from the U.S. goes to a country where they're having very large numbers of outbreaks, or somebody from that country comes to the U.S., interacts with somebody from these susceptible pools, and it's like throwing a match on gasoline, and that's what's happening.
Do you think that this is going to become the norm now, that we're going to see measles cases every year?
I think so. I really do think so, until we no longer have susceptibles. That's the way measles works.
Do we know any reports of any deaths resulting?
I don't think thus far there have been any deaths.
Not this year, but measles can.
Oh, absolutely. Like about 1 to 3 people per 1,000 that get infected. So we haven't had 1,000 cases yet, so it's not surprising we might not have seen a death. But if you're a pregnant woman and you get infected, it's likely let me put it this way: you have a high risk of losing your baby. That's a death.
And it could cause blindness.
And it can cause blindness. It can
this
cause
is not a benign disease.
encephalitis.
Encephalitis. What do you mean by encephalitis?
So literally, they can develop mental status changes, convulsions, deafness. Those are permanent. And then there's a disease called SSPE. This is a chronic, long-term, untreatable disease where you basically become demented as a result of having had measles infection.
So for your children, when should they get vaccinated?
Well, normally, they get their first dose at 12 months. In these areas that are having outbreaks, because of the concern, they're recommending they get it at 6 months, a second dose at 12 months, and a third dose at school entry.
All right. There's absolutely no reason not to have your children vaccinated.
None at all.
All right, measles was declared eliminated, eradicated from the United States in the year 2000, but it has now certainly made a resurgence. So far this year, over 700 cases reported in the U.S., 22 different states. Most of the cases are in people who have not been vaccinated, correct?
Correct, the vast majority.
And the World Health Organization says the reluctance on the part of some parents to have their children vaccinated is one of the top 10 health threats worldwide. I'm sure you would agree.
Absolutely.
Dr. Greg Poland, infectious disease specialist, and by the way, editor of the journal Vaccine. You probably didn't know that.
I did not.
Thanks for being with us, Dr. Poland.
My pleasure.
That's our program for this week.
Perfect, as always.